Hi, I'm Dr. Ritakshi, and in this video, I'll talk about liver disease, specifically fatty liver. Now, fatty liver are of two types, alcoholic fatty liver and non-alcoholic fatty liver. Today, we're going to focus on non-alcoholic fatty liver. As the name suggests, fatty liver is when there's accumulation of fat in the liver. So, the functions of the liver would be affected and there will be further damage to the liver and could cause cirrhosis if there is no management or treatment taken on time. Non-alcoholic fatty liver disease is developed in 4 main stages. So a lot of people usually just have the first stage development and they don't even realize it that they have it. But in some cases, this can progress and it can cause further damage of the liver. And this usually happens when it's not detected on time or it's not managed properly. The first stage is simple fatty liver, which is also known as steatosis. Now in this, there is a healthy amount of distribution of fat and deposits of fat in the liver. This can usually be identified through our blood tests and liver function tests or from the ultrasounds. This is very much reversible. Second stage is non-alcoholic steatohepatitis or NASH. In this stage, this is a more serious form of non-alcoholic fatty liver disease because now there is also inflammation of the liver with accumulation of fat. This second stage is also reversible. The third stage is fibrosis. Now, fibrosis is caused when there's persistent inflammation or inflammation for a longer period of time. And when there is persistent inflammation or inflammation for a long time of the liver, then it causes scar tissue around the liver and around the blood vessels. So even though there is inflammation and there are scar tissues, the liver is still able to function normally in the third stage. And this is also a reversible stage. The fourth stage is cirrhosis. This is the most severe form. And this usually occurs when there's persistent inflammation for a longer period of time, mostly years. It takes years to develop cirrhosis. And now the liver is damaged to a point where the liver starts to shrink. There's a lot of scar tissues. There's also lumpy appearance of liver. This damage of the liver is permanent, it's irreversible, and it can lead to liver failure as well. It takes years to develop fibrosis and cirrhosis of the liver. It's important to make lifestyle changes and some dietary changes so that we can manage and control the condition before it gets worsened. So you're basically at risk of getting non-alcoholic fatty liver disease if you have type 2 diabetes, if you're overweight, your BMI is not in the normal range, and especially if you have an apple-shaped body, which means that you have more fat deposited in your belly area, and if there is any insulin resistant condition such as PCOS, PCOD, or you have high cholesterol, high blood pressure, or any sort of metabolic syndrome. So for signs and symptoms of non-alcoholic fatty liver disease, now usually people don't feel anything in the first stage of this disease. So it's usually just diagnosed when there are blood tests done for other conditions or other problems, and then the liver function tests usually don't come normal. Occasionally, there are some signs that people usually feel or develop when they have usually progressed to NASH or fibrosis of the liver. So these symptoms would include, there would be a dull abdominal pain, especially in the right upper quadrant. There is loss of appetite. There's weakness or fatigue. You could have some muscle wasting. There could be weight loss as well. There is usually vomiting and nausea. Then there is pale stools, dark colored urine, you could have fluid accumulation in the abdomen, ascites, or you could have easy bruising of your wounds, and you could even develop some confusion. Now let's see how we can manage non-alcoholic fatty liver disease. First and the most important is weight loss. Now the first line treatment of non-alcoholic fatty liver disease is usually weight loss, and this is done by calorie reduction, exercise, and eating healthy foods. Now in liver disease, in non-alcoholic fatty liver disease, we should aim to lose at least 10% of our weight, and we should make sure that we lose this weight gradually, because if we lose our weight too fast, then this can counter effect and there will be more accumulation of fat around the liver. So what's the aim? Now we should aim to lose weight for around 0.5 to 1 kilograms per week. As we know, obesity and being overweight is a risk factor of non-alcoholic fatty liver disease, so make sure to maintain a healthy weight. Second, we should include vitamin E. Vitamin E is an antioxidant, and they usually help us with removing toxins from our body, removing free radicals from our body. So vitamin E is usually needed for general liver health as well. So there will be, if there's any inflammation in the liver, vitamin E could help us lower the inflammation. Now, where do we get vitamin E from? Vitamin E is usually found in nuts and seeds. So you can have almonds, walnuts, seeds such as sunflower seeds, flax seeds. The recommendation of vitamin E is usually 800 units per day. Third is coffee. Now, coffee has shown to be beneficial for liver health, and consumption of coffee can lower the risk of developing non-alcoholic fatty liver disease. Also, it lowers the risk of progress to fibrosis if you already have non-alcoholic fatty liver disease. Drinking 3 cups of coffee per day has shown to have some benefits in lowering the risk of developing liver disease, and caffeine in general is known to protect our liver from developing liver disease or damaging the liver. Fourth is to choose the right kind of fats. Now, the fats that we're looking for should include omega-3 fatty acids, or they should be monounsaturated fats. These fats usually make our body use the insulin better, which means that the cells of our body would use the glucose and not make the liver store it as fat. Omega-3 fatty acids are usually found in nuts and seeds. So in nuts, particularly walnuts, and in seeds, flax seeds or flaxseed oil. They're also found in green leafy vegetables, and they can also be found in oily fish such as tuna and salmon. Monounsaturated fats can be found especially in nuts, olive oils, and avocados. Next is soy or whey protein. Now, a low protein diet can lead to liver inflammation, so we need to have adequate amounts of protein in our diet. Studies have shown that vitamin D deficiency can increase the risk of developing non-alcoholic fatty liver disease. Low levels of potassium are also linked with increased risk of developing non-alcoholic fatty liver disease. Now, we can get our potassium from foods such as broccoli, peas, kiwis, bananas, mangoes, fish, especially oily fish such as tuna, salmon, cod. Dairy products such as milk and yogurt are also high in potassium and also in vitamin D, but we should make sure that we choose low-fat dairy products. Next is exercise. Now, we have to exercise for a healthy liver. Aerobic exercises have shown to cut down the fat in liver, and also Heavy workouts may also reduce the inflammation of the liver. So make sure to add also resistance or strength training as well, such as weightlifting. So a combination of aerobic and resistant exercise can improve fatty liver disease. So we should aim to get around 30 to 60 minutes of exercise per day. Mediterranean diet is not exactly created for people with fatty liver disease, but it's a diet that promotes good health. So basically there is a combination of foods that will help you reduce the fat levels in your liver. A Mediterranean diet aims to include a lot of fruits and vegetables, whole grains, nuts, legumes, fish, and dairy, low-fat dairy. And this excludes simple carbohydrates. There's less consumption of red meat, and there is less consumption of sugars and fats. Avoid alcohol use. Now this is the most important thing in non-alcoholic fatty liver disease, is to reduce or abstain from alcohol. Now alcohol leads to inflammation, and we already have fat in our liver that is causing inflammation in this disease. So when we drink alcohol, there will be further inflammation and there will be progress of liver disease, and then there would be further damage to the liver. We should avoid saturated fats in our diet. We should avoid red meats. We should avoid poultry except for lean meats. We should avoid high-fat yogurt or high-fat dairy products. Stay away from sugar and sugary foods. Stay away from fried foods, processed foods, and simple carbohydrates, or even refined carbohydrates. So if you have non-alcoholic fatty liver disease, or if you're at risk of developing this disease, then making some lifestyle changes and some dietary management can help you reverse this, and it can help you prevent from getting liver disease. Making these dietary changes, having a well-balanced diet, along with some lifestyle changes that include exercising, losing weight, improvement of sleep, and reducing stress, these can all help you manage your non-alcoholic fatty liver disease. Thank you for joining in and watching this video. I hope you liked it. If you did, please like and share this video. Also make sure you subscribe to my channel for more information like this, and press the bell notification button so you're notified whenever I post a video. Thank you for joining in. Bye.